Alright everyone, today we are going to start talking about oxygen delivery. We're going to talk about two main devices today. We're going to talk about our nasal cannula as well as our non-rebreather or NRB. So we're going to start with, first things first, we want to go ahead and put on our PPE. We're going to take our tank, which for the purpose of this we're using a dummy tank so it's not live oxygen. We will take our oxygen wrench. We're going to crack our oxygen tank so that we blow out any debris from our valve. After we blow out that debris, we're going to close it, and that does only need to be a very quick. Okay. We're going to take our regulator. First thing that we want to verify on our regulator is that we do have our O-ring in place on this one. You can see this big yellow ring. That is our O-ring. On the bottom side of our regulator, you can see these two pins. Those two pins are going to line up with these two holes. It's set up so that if you wanted to, you can do this eyes closed in the dark. So we're going to take this, place it down on, sink those pins, tighten down our regulator. After our regulator is tight, our PSI gauge should still be reading 0. We are going to take and open this up with 2 full turns. So there's 1, 2. At that point, our PSI gauge should read up to 2000 PSI, ideally. Prior to applying any oxygen, we want to assess our patient. So we're going to assess our patient's level of consciousness, asking them how they're doing, if they know what's going on, what problems they're having. We're going to listen for any loud, audible respiratory sounds, stridor, audible wheezing, any adventitious sounds that says, hey, this guy really is struggling to breathe. We're going to assess their respiratory rate, depth, and effort. Ideally, they're between 12 and 20 for a normal, healthy adult with non-labored respirations. So we're going to count the respirations for either 15, 30 seconds, or a minute. If it's by 15 seconds, you'll take that number, you'll multiply it by 4, that'll give you your respirations. If it's by 30 seconds, then you'll multiply that number by 2, that'll give you your respirations in a minute. And if you count for 60 seconds, you got your respirations, right? We want to assess their skin color. We're looking to see if they're pink, warm, and dry, cyanotic, or blue. If they're cool, clammy, diaphoretic, and sweating. We will take our SpO2 monitor, put that on their finger, and check their SpO2. We're also going to assess their lung sounds. So we'll take our stethoscope. We're going to assess their lung sounds. When we're assessing lung sounds, we're doing bilateral, so we'll do upper compared to upper, lower compared to lower. Same thing on the back. We're going to do upper, upper, move down, and on the back we are following the curve of the scapula or the shoulder blade, so we're just making that curve there. Once we decide if they need to be on a nasal cannula, we're going to take our nasal cannula out, turn this on between 2 and 6 liters per minute, so I'm going to just turn it on to 2, plug that in. Ideally, whenever you are putting on a nasal cannula, you will go from the front, wrap behind the ears, and then tighten it up underneath the chin. However, our mannequin does not have ears, so I'm going to go ahead and just place this behind their head so that we can hold the nasal cannula in place. So we've got the nasal cannula in. This nasal cannula has an extra device on it called end-tidal CO2. That is measuring the amount of CO2 that is being blown off at the end of every exhalation. This is our little adapter for it, the nice orange guy. You can see on here it has a gold ring. We need to be very careful of that gold ring whenever we place it in. On our Life Pack 15, we'll lift this flap, plug this guy in, and we're just going to turn it 1 or 2 times. If you over tighten it, you will break that gold ring, which will then render that end-tidal obsolete. That is how you hook up a nasal cannula. If our patient needed a non-rebreather, let's say that it's this same guy and we're switching from a nasal cannula to a non-rebreather. We want to get our non-rebreather all set up. We're going to unplug our oxygen. Non-rebreather is 10 to 15 liters per minute, so we're going to twist the flow meter to 10 to 15 liters. This one is only 10 or 15. Some of them do have 12. We'll start at 10. We're going to hook up our oxygen tubing. First thing that we do before we place it on the patient, inside here is a little valve. We're going to cover this valve with our finger. That's going to allow our reservoir bag to fill with air. Once that is filled, then we are going to, on this guy, since we disconnected the end title, we'll go ahead and take that off. We're going to slide this over the head, onto the bridge of the nose. We're going to tighten it down. Every single time that we do any intervention, we want to reassess. So we would reassess skin, level of consciousness, respiratory rate, depth and effort, their SpO2, as well as their lung sounds. And that's it for oxygen delivery, guys.